our country, if not the world. It's got a larger ecosystem. It's got more regulation. It's got more good and harm that can befall, the participants. So it's got a lot of and it's getting more and more expensive. And in fact, I know many would say it's out of control. So I think that in terms of innovation, I think the innovation, if that's the question, it can touch almost any aspect of this continuum, whether you're going after costs. I think what a lot of innovators are doing right now is looking at how they can improve clinical care. How can they actually affect the experience, or how can they actually make people more healthy? Whether that's through recommendation systems with Q&A, or whether that's with better diagnostic tools. Doing something better than what I can do when I've got a condition and I'm going onto a search engine to get an answer. Maybe I can, and we can do better than that. So I think that there's a tremendous opportunity for innovators. And I'm just going to go back to what I said at the beginning, which is the triple aim. So attacking any of those three items is a white space for innovators. And there's no lack of white space. Well, digital health is more of a journey than it is an end product or an end thing. Just as a basic example, if we go back to the 1950s, we would have considered using the telephone digital. And obviously today we don't see that as digital. The point I'm making, of course, is that as more technology innovation occurs, our expectation changes of what is digitization. So I would say digital health is a lot about applying computational technology, smart devices to have interconnected health. So when we think about interconnected health, wouldn't it be nice that in your home, that could be a smart space? As a smart space, it becomes aware of things that maybe we didn't know beforehand, but we should know. If we think about aging population, knowing that you've fallen, knowing that you haven't gotten out of bed, knowing what you're eating, all of these things are things we can do with contactless sensors. So when I think about digital health, it's a myriad of and a constellation of technologies. I think about wearables. I think about, as I said, contactless sensors. I think about ambient computing. I think about using artificial intelligence. And we also know with emerging, not just emerging, present and emerging technologies like federated learning, we can actually start training models on your local devices or with the benefit of other millions of devices without having your data move to the cloud and perhaps compromising your privacy or your security. So when I think about digital health, I think about how do we create and enable people to live healthier lives by the space that they happen to move in, whether it's home, whether it's work. And so it's creating real-time experiences. We're not there yet in terms of having real-time payments, to be able to have sensors and this notion of ambient intelligence where through the use of sensors, whether those sensors are wearable or whether they simply are sitting somewhere in the home, but having computing be invisible versus what we've done in the past is to try to make computing irresistible, where we want it to go and wow you. But now the wow factor should be the fact that you're seeing an experience and you don't even know that technology is present. It's embedded, it's in the environment, it's contextual. So that's what I think of when I think of digital health, is invisible technology that is actually helping individuals, communicating with physicians, clinicians, and working in this seamless fashion, both the physician, the hospital, the provider, the patient, such that we can actually move the needle on those triple aims. Most of us have lived through two computational waves. That first wave was where computing was pretty much provided by big corporations because, and to some extent, when we look at how we train some of the AI models, we still need that heavy duty computing power that you get from a big cloud provider or from a big corporation. And then of course, personal computing arrived. And I know I've talked about this briefly already, but ambient computing is that third computing wave. So ambient computing is where, just as a small example, I have a smart bottle, and it's going to vary by person, but that smart bottle helps me regulate how much water and reminds me. I think we're going to see more of that. I have a smart scale in another room, and all of these things, smart toilets, smart scale, smart toothbrushes. I mean, these are small items, but I know that collectively these are going to be more interconnected. We're going to see platforms emerge that take advantage of this and provide opportunities for us to have more insights into conditions influencing our health. So ambient computing is one technology trend that I see that's on its early stages. I would say we're about in 1980 where personal computing was. So when you think about where personal computing was in 1980, we're about the same point in time with ambient. I think smart spaces is another area where it's going to let us go to these dark spaces of healthcare that we've not seen before. A person's in an ICU and there's not a nurse around, or maybe a person needs to be picked up and moved every 30 minutes. We're going to know if that's happening. So we've got smart spaces, whether it's in the home, whether it's in the hospital. We've got wearables, smart devices, smart things, what some call the medical IoT. So that's a third trend. We have, even though I talked about ambient computing, which is sort of the underlying layer, we're going to have ambient intelligence, where we're going to have more insights and more feeds. We're going to have more natural interfaces, which are not just going to be touch and gesture, but are going to be voice. We're going to see better conversational dialogues occur that are going to be domain specific early on, that are going to be very rich conversationally, that we can actually have a conversational about our health. I won't be able to ask it questions about Socrates or go off, but we're going to be able to have these kinds of domain specific conversations. We're going to see more AR, VR technologies come into play. We're already seeing this today with mental behavioral health. We're going to see that as well. And then artificial intelligence. It's going to be it is a general purpose technology. It's going to be the basic technology that's powering all of these other trends that I just mentioned. So I don't think I've covered them all, but those are a snapshot of a few of, I think, some of the hot trends.